Hi everyone, welcome back to From Jova's channel. So in my channel, we talk about everything health. We talk about foods you can eat as you age. We talk about foods you can eat that have benefit your health. We talk about things you can do to stay healthy. So if you're the type that is concerned about what you eat, then you are in the right place. All you need to do is subscribe to my channel. Turn on your notification bell so you don't miss out on our subsequent videos. So today we are talking about 10 things you need to know before you make up your mind to have a fibroid surgery. So what are fibroids? Fibroids are actually non-cancerous growths that grow either inside of the uterus, within the walls of the uterus, or outside of the uterus. Now, when you have fibroids growing inside of the uterus, they are called submucosal. Where you have them growing within the walls of the uterus, they are called intramural. But then when they grow outside of the uterus, they are called subserosal. Now, there are actually women that have fibroids that do not even know they have fibroids. And that is because they do not exhibit the symptoms. But then you have other women that have fibroids and they know they have fibroids because they exhibit symptoms like heavy menstrual bleeding, prolonged menstrual periods, they have pelvic pain, they have pain during sex, and a whole lot of symptoms. Now, I need you to understand that 90% of women are actually likely to have fibroids. So far, you're a woman and you've reached the age of childbearing, you're likely to have fibroids. Now, what are the 10 things you need to know before you make up your mind if you want to have a fibroid surgery or not? Number one, you need to understand that you can actually manage and shrink those fibroids naturally. You don't necessarily have to go under a knife. You can manage and shrink those fibroids. One, by educating yourself. You need to educate yourself. You need to ask questions. You need to carry out research to be sure that there are things you can do that can manage those fibroids. Number two, I need you to understand that medical doctors are not equipped to assist you in healing your body. You on your own, you need to build a relationship with your body. You need to heal your body. You need to know exactly what you're supposed to do, what you are doing wrong, and how to get rid of it. Then, number three, having a fibroid surgery is actually very painful. I've not had any, and I'm not going to have any by the grace of God. But then having a surgery can actually be painful because I've done my own research and I've spoken to people that are around me that had the surgery and they've told me how painful it was. And trust me, it takes about 6 weeks or even more to get healed. Then number four, having a fibroid surgery will not treat the condition. It is not going to stop you from having heavy menstrual bleeding. You're still going to have heavy menstrual bleeding. You're still going to feel the pelvic pain. If you don't treat the root cause of the fibroids, then having a surgery doesn't mean you're not going to have heavy periods anymore. The number five, having a surgery doesn't mean it is going to treat the fibroid. Like I said, you need to treat the root cause of the fibroid. You need to know what is causing the fibroids to grow so you can get rid of them. So you need to treat yourself. You need to talk to yourself to exercise patience. You need to ask questions to be sure to know the root cause of these fibroids in order to get rid of them and get rid of them for good. So before we continue, if you've not subscribed to my channel or if you've watched this video up to this point, I'm glad and I know that, okay, you're enjoying it and you really need to know. So all you need to do is make sure you subscribe to this channel, turn on your notification bell so you don't miss out on our subsequent videos. So number six, you don't always have to believe what the doctor said. Now, I am not saying you shouldn't listen to your doctors. I am not saying you shouldn't take advice from your doctors. But most times, the problem is not as big as they make it seem. It's not as big as they make it look. So that is why it is important to always give yourself time to be sure that, okay, this is exactly what I want to do. And this is really what I want to learn. So most times, the problem is not as big as they make it seem. Then number seven, having a fibroid surgery doesn't mean it is not going to grow back. Those fibroids are going to grow back if you don't treat the root cause of the problem. Then number eight, you need to check your hormones. It is very important. Most times it is important to check your hormones to be sure that you are not having hormonal imbalance. Because in a situation where you have your estrogen levels being higher than your progesterone levels, that is where the problem starts from. Then, number nine, you need to be sure that you're going to reduce your intake of sugar. Now, high blood sugar level and insulin sensitivity plays a major factor. So you need to get rid of that particular factor. Number 10, having a fibroid surgery could lead to future complications. Now, I am not saying when you have a fibroid surgery, you're not going to give birth anymore. I didn't say that. Having a fibroid surgery could lead to complications, especially for people that are in their mid 30s and in their late 30s. You may be putting your uterus at higher risk. That is why it is important to always try out home remedies. There are things you can do to shrink those fibroids. So in our next video, I'll be telling you guys the foods you can eat, what you're supposed to do to shrink your fibroids, things you're supposed to do to avoid those fibroids from growing back. So I hope you've enjoyed this video. Thank you guys so much for watching. So if you've not subscribed to my channel up to this point, please make sure you subscribe. Turn on your notification bell so you don't miss out on our subsequent videos. Have a nice day, guys. Bye.